Hello and happy Monday. Welcome to another Money Monday with Purse Strings. For this whole month of, what are we in now? May. We were talking about, taking care of aging parents and the cost that takes and different things we should know about. And so we have Laura today with us, who's going to be talking about Medicare and what to really know and what needs to be done first. So anyone who's new to Purse Strings, I just want to let you know that we're here for tips, tricks, pieces of advice on how to be financially fearless. And then when you need Medicare, you need to update your will and trust. You're planning for retirement, you're having kids, whatever it is, we have top tier financial professionals willing, ready, and able to serve you. And that could be people who specialize in Medicare, they specialize in long-term care insurance, retirement planning, all these different things. They all are part of our picture. We call these professionals our Purse Strings approved professionals, and Laura is one of them. So we're so excited to have her on today. And before we dive in, Laura, could you give us a little intro of who you are and what you do?
Hi, my name is Laura Winningham. I have been in doing, Medicare supplements for over 10 years. And I mostly dealt with teachers, city, state, and county employees. And now I've launched my own business to expand it to everybody that needs, an advocate on their side when dealing with Medicare and going on to Medicare for the first time.
Awesome. Well, we're excited today to have you share your expertise. And if anyone's tuning in and has questions along the way, they can throw them in the chat. We're happy to get to those. If you're watching the replay, we can try to come back to those as well. But we're just going to kind of dive into almost like a scenario today to really get this a little bit more applicable. And, just kind of that scenario of I'm taking care of my mom and she falls and she breaks her hip, and really kind of helping her through this process and kind of regards to Medicare. And so, at the beginning, is there anything that we need to kind of know about as first steps of kind of using our Medicare plan?
Okay, under that scenario, you're telling me that somebody just fell and they're going into the hospital.
Right.
So the very first thing that it's tricky, a lot of people don't know this, but when you first go into the hospital, the first thing you want to do is after they evaluate you and come back is you want to make sure that you're not in observation status. Most people don't know that. You want to make sure you're admitted into the hospital. The reason for that is when you fall and break something, you're generally going to need some rehab. And if you're under observation status and they have you sign now that you're under observation status, don't sign it. Because what it'll do, it'll affect how your rehab will be paid for.
Wow.
Yeah, big deal. So that's something a lot of people don't know about. So you want to make sure you're admitted to the hospital. So once you're admitted, then you can just relax and concentrate on getting better because, from day one, you'll be paid for Medicare for the hospital stay up to day 60.
Wow.
Now, generally, when you fall and break a hip, you're not going to need that many days. They're going to treat you. And then, if they do surgery, you might go to a rehab center, or skilled care. Mm-hmm. And that's what's so super important that you didn't go under observation, because if you were in observation, you would not get that paid for. It come out of your pocket. Yeah. So, but if you are admitted, relax because not only is Medicare going to pay, but if you have, there's two ways of going on a Medicare supplement. There's a supplement, which is called a Medigap, or there's an Advantage plan. And the only difference is your out of pockets. If you're on a Medicare supplement, the original Medicare with a supplement, you're going to be covered all the way up to 100 days on the skilled rehab. If you're on an Advantage plan, you'll probably have some copays. So the best thing to do is when you first sign up for Medicare, that's the only choice you need to make, which direction you're going to go. Are you going with an Advantage plan or a Medicare supplement? So that's some things that you'll need to look at. And it only determines what your copays will be. So that's why that's important. So,
Yeah, that's huge to know about the observation.
Huge.
I mean, That's
Yeah,
like, I'm so, just if you to get anything from this call, make sure you're not
exactly.
under observation. And that's
Exactly.
something they tell you, where you kind of have to request to
Yeah,
know.
I think now they have to have you sign a paper. And so when you're
Okay.
in the hospital, a lot of things are going on. You don't want to willy-nilly sign that paper. So if I tell you up front, that's what you're going to look for. Once you go in the hospital, you're going to be thinking about that.
Yeah, definitely. And
You'll be aware.
then you can relax and heal.
Yes, exactly.
And so then you kind of said, from that hospital, most of it's covered due to Medicare,
Yep.
which is awesome. And we
Right.
want to make sure,
Right.
that's great. Um, and so was there anything to like use your Medicare that the person needs to be proactive about contacting, or making sure things are processing properly?
Well, like I said, the nice thing is, and that's probably what I get a frequent call on. Somebody's going for a hip or knee surgeries, and they're calling me saying, "Okay, what am I facing here financially?" The first thing I tell them to do is relax, and it's all covered because I have put them on the right plans that cover a lot of things for them. The other thing that, as far as being proactive. The way it works is Medicare. Well, if you go in the hospital, it'll cover day 1 through 20.
Okay.
And then from day 21 through 100 days, if you have a supplement, it'll cover that. So if you need home health care, if you need to go to an assisted living, that's all going to be pretty well covered for you.
Okay.
But the thing of it is after 100 days, then it falls on you to come up with all of the money for a, like a rehab facility, assisted living or a nursing home. So the proactive thing you want to look at is, covering that gap. And there's a lot of products out there. Long-term care traditional products are still around. There's not very many of them. But the nice thing is, there's been some companies come in and actually offer something that's a 1 year or 2 years of coverage. Works just like the long-term care, and it's interesting because it'll give you money directly to pay for that. So part of my planning when I sit down with some people that are looking at just buying a Medicare supplement, I go a little deeper and we do all the planning. So that way, when something happens, you already have the coverage.
Mm-hmm.
So you don't have to do the caretaking. You can actually have home health care that's covered. And then you can actually go into an assisted living facility, for a short-term stay. And these can cover 1 to 2 years, which is
Wow.
great because the average stay, I think that statistically, probability needing more than 1 year is only 22% for men and 36% for females.
Mm-hmm.
But if they go up to 5 years, it's only 2% for men and 7%. So you can see if you have some coverages that are in place for those gaps,
Yeah.
then you don't have to dig into the savings. So anything
Right.
that happens, you're covered. You've got all those contingencies in place. So that's very important.
And so you said you kind of help with like the longer term coverage. It's not long-term care coverage. But what else? I know it seems like there's a lot of moving parts, not just like,
Right.
I'm just getting Medicare, but you're getting a couple different products, so to speak. And so is that really expensive to that person? I mean, I know it's always weighing the cost of how much is it going to be if you had to spend 2 years in a rehab facility, which is expensive.
Oh yeah, no, I mean, it's actually not expensive because falling into those gaps could absolutely devastate, everyone. And
Yeah.
not only that though, it's do you really want your child to stop their full-time career and take care of you? Or do you just want to say, hey, I've got it. I pre-planned for this. I've got somebody coming in to the home and offering me home health care. Now, Medicare does offer some home health care, but some of these policies will pay you in addition to that. And then it will extend what Medicare will do. So Medicare will pack up and they'll leave. And you're like, but I still need this. And so if you have the policy in place and it pays day 1, so it's already paying you. So when they pack up and leave, you've got plenty of the money to use as a benefit. And it's a benefits are not taxed. So it's kind of
Oh,
using tax-free money for that. So
yeah.
it's the pre-planning is essential. Everybody thinks, oh, it's not going to be me. It's not going to be me. And that's just burying your head in the sand. It is, I mean, it's a high percentage it will be you.
I
So,
mean, no one
yeah,
plans to slip and fall. That's never
no,
the idea, but it happens.
or nobody plans on getting MS and some of the other things that are just really going to devastate the family as far as caregiving.
Right.
And if you've got a plan in place, I mean, that's nice. You get to see your kids when you want to see them and not because they have to come and take care of you. So it makes that relationship a lot better. With your kids and with all your other people, they're not so stressed. You're going to end up stressing out your caregiver more than you're stressed. So,
Right, definitely. And being on the other side as kind of that child, it's really comforting to know, like, if mom fell, I wouldn't have to get up and leave my job right away to take care of her.
no, no.
Which is a huge relief. I couldn't imagine if you had like small children at home and different things like that as
Mhm.
well. You can't manage it, but knowing that they're okay and they not just like, yeah, I'm fine, but like, no, you actually are okay is really a game changer. Just kind of
Right.
that sense of ease for the child.
And compared to the cost of actually spending that money yourself, it's astronomically much more affordable to just buy a small premium to know it's going to exist. And then
Right.
it'll just, that's what insurance is for. It's so you don't have to pay the full cost. You're only paying a fraction of it. I mean, that's
Right.
is you don't want to believe me, my mom needed long-term care and and it did. She had over $1 million and that's where all the money went because she had Alzheimer's.
Wow.
So you don't want to, you don't want to do that. So that's my passion, is to try to keep people from, just all the hard-earned money that they spent. That's where it goes. I don't like that. I'd rather it not go that direction. Plus, the biggest thing is the stress off of the family members, I
Yep,
think.
definitely. And so when do you have to start applying for Medicare?
Well, in Medicare, you want to do that at when you're getting ready to turn 65, or if you decided to keep working, you can apply for Medicare whenever you decide to retire. And so if you're 66, 67, 70, you can, 2 months before you retire, then you can start doing your Medicare. But 6 months before you turn 65, if you want to go ahead and go on Medicare, that's a good time to start.
Awesome. And so what's your kind of role in this process? Let's say I need Medicare, I'm thinking about it. How can you help me in this decision?
Well, I will tell you, I'm a person that takes the client and I put myself in their shoes because I've been there. I saw how we spent the inheritance of our family. And
Yeah.
so I not only do the Medicare, but I look at all the pieces that can hit them because they can't buy the products after something goes wrong. So I kind of sit there and really work out strategies for a lot of planning all at once. I mean, nobody wants to go in and piecemeal it and see 9 or 10 different people and get all confused. You really want one person that you trust to sit down, and we kind of call it a Medicare marriage. I'm in the marriage with them. I love that term because honestly, I'm there no matter what questions they have, what hits them in life, and they love it. They love just calling me and saying, okay, what do I do? So I did a lot of pre-planning that I can usually just say, hey, relax, you're covered. Here's how it works. So it's really key to go in and do a lot of planning on everything, not just your Medicare. Look at everything that can happen and start figuring out what you can afford to buy to kind of prevent those big layouts of cash, and then, like I said, and also prevent the stress. I think that's key.
Yeah.
Stress prevention is super key. You don't want to stress out your family because you didn't do the planning.
And the thing I love, like talking to you and knowing what a great professional you are, is that you look at this holistic picture and you're not just like, oh, wait, you want a Medicare? We'll look at that, because
Right.
that can really mess up the whole plan.
It can.
And so, it's sometimes people don't know that there are other things that they need to ask about. And so you just
Yeah.
being kind of proactive in that scenario
Mhm.
is super helpful. And also, yeah, it just is like, oh, good, you're looking out for my family. And I know when people like need to use those products, they'll call you and ask you questions as well, right? Just to confirm
Right.
things,
Right.
which is just great having someone on your side and not calling like
Mhm.
a customer service board
Yeah.
somewhere else.
Yeah.
It doesn't always work.
No, it doesn't. It's really frightening because a lot of times when they call into the carriers, it depends on how much training the person on the other end has gotten. So sometimes they won't give you the right answer. So it's best to call me because I already know kind of what the answer should be. So when I call in and I get the answer that's not quite right, I just keep calling or speaking to somebody else until I'm assured that it's the right answer. So, that's what I'm saying. It's nice to have, I call myself an advocate. So I'm an advocate on your side. And because I'm so steeped in the knowledge with this, wasn't hired a year ago or 3 months ago. I can pretty much go and figure everything out for you and know what questions to ask, know when they're not answering it correctly, which happens, which is scary. But that's why you have an advocate, is because I want to get to the bottom and get the right answer.
Which is exactly what I want when I'm trying to heal, is like not to take care of all of that. That sounds like a whole thing.
No.
And so how much are your services for you to help pick it out, have these calls, all the stuff?
Oh, that's a great question. I'm glad you asked that. It's free. So you can get an advocate for free. The reason for that, I am an independent agent. So that means I'm not pushing a product on you. I'm not calling from XYZ company and telling you XYZ company is the best one for you because it's the only one I can offer.
Yeah, right.
Instead, I can holistically figure out your situation and match you up to the carrier that provides the best solutions in your area. They're all different in different zip codes, so they're all different. So we look specifically in your area, your hospitals, and different dynamics like that, and we come up with the answer. Now, once we select the product that works for you, the nice thing is the carrier pays me, and it's
Awesome.
the same price as if you went out directly to the carrier yourself. So there's no markup at all. They will pay me instead of you having to worry about it. So you get free advice that way.
You can't go wrong there. You just need to get a good person on your team, like Laura.
Exactly.
And so when it comes to like Medicare, either if you had this falling accident or just before, are there any like common mistakes that you see that you're like, oh, I want to get ahead of, either using your Medicare or not applying for it sooner or something like that?
Well, yeah. Well, you want to make sure, don't ignore not applying for it. There's lots of penalties of trying to get into Medicare later in life. So yeah, don't mess around with that. You're 64 and a half, call me because that's the best time to start planning. Or if you've been working till you're 70 and you're just now thinking about retiring, call me because that's the best time. So it's all about planning. Because you don't want to go in blindly and think that you're all the way covered and then find out you're not. So there's lots of penalties if you don't sign up on time. And those penalties through Medicare last a lifetime. They don't play around with that. So you want to make sure you understand what you're doing right from the beginning stages. And a lot of times people will call me and they'll be working and they'll say, well, do I need to go on Medicare now? I'm going to continue to work. I think that's probably the biggest common mistake is a lot of people believe that their insurance through work is going to be more powerful than Medicare. And it's sometimes, you're right. I would look at it and say, you've got a good deal going there. Just hang in with it. And it's great. Call me when you get ready to retire. But mostly, and this, is insurance is expensive. They're cutting costs, a lot of companies. And so it's interesting because you may have an $8,000 deductible on your insurance and you may be paying more than it would cost you to go onto Medicare. So you really want to look at that because your deductible with Medicare is $226 a year.
Oh, well, that's pretty good. It's cheaper than mine.
Yeah, exactly. And then, the cost of going on might cost you $250 a month. And if you're already paying $400 or $500 a month and you have an $8,000 or $10,000 deductible, you tell me which one's better. So you'd really want to evaluate. You don't assume your insurance through work is the one you want to stay on. And it all depends on what's going on with you medically. So I need to kind of dive into that to really give you the best advice. It's all customized. But I think people assuming to stay on their regular insurance is better is a big mistake sometimes.
Yeah, yeah. So it seems like, yeah, if you are 64 and a half, you want to just have this conversation just to see, what your best option is.
Mhm.
Because there's no reason to pay more if you don't have to.
And the
Um,
consultation is free, so you can call and ask. And so, it doesn't bother me that I tell you stay on your health
yeah,
insurance. You just become my future client and my future referrals.
right, exactly.
So it doesn't bother me that you're going to continue to work and won't need anything from me. But eventually they come back and they're just grateful that I gave them the advice.
I love that. And that's why, again, I know you said you had to, you always have to disclose some medical information to kind of see, what benefits you're using in those packages. And so
Mhm.
you want to make sure you have somebody that you feel comfortable, sharing those things with, because they're very personal.
Right.
And so, just make sure you find someone that you feel comfortable with, kind of sharing some of these things, sharing your life with, because they will know a lot about you, but it's also, a great relationship to have someone free help you pick out these things that are, they're a big area in life.
Right. Right. Exactly.
I feel like we touched on a lot of great information. Is there anything that we didn't touch on that you want to make sure is shared today?
No, I think like I said, the big piece was the observation piece. A lot of people don't recognize that, so
Yeah.
that's super key. So you want to make sure you're admitted. If you're not admitted, say I'm leaving. See ya. And
Goodbye.
it's amazing how they quickly admit you after that because it's a matter of money, and
Yeah.
unfortunately the hospitals are struggling. So you want to be sure that you're covered the right way. So that's the biggest key. The other thing is just, what we talked about is when you're planning to go on Medicare, look at it holistically.
Hmm. Yeah. Awesome.
Mm-hmm.
Well, thank you, Laura, for providing this great information. If anyone is, almost turning 65 and needs to talk to Laura, please contact her. Or if you have any questions with what you have going on, her email's been going through the bottom, laura@lifemapinc.com. She's also one of our Purse Strings approved professionals, so you can reach out to her off our site, pursestrings.co. Yeah, if you have questions, reach out. Let's be proactive. Let's be prepared. Let's have that free advocate on our team. And we'll be back next week. So until then, be financially fearless.